Switching now to our second midday forum, and joining us is Dr. Omar Nass with CHI Health Nebraska Heart rather. And today we're going to be talking about some new technology that's available to try to help people with some heart problems. And what are some of these new technologies?
Well, thank you. Cardiac imaging has been very important in cardiology. The new technologies involve tests that either diagnose the problem before it occurs or diagnosing it after so that we can plan treatment. The new technology tends to be more accurate, higher resolution, safer, less invasive, hence it's easier on the patient. And hopefully if it prevents or avoids the need for invasive testing, it'll be more cost effective.
Very nice. Now, it seems like it used to be there was a stress test. Maybe you have to hop on the treadmill, see how long you can go. That's done away with, or what's the status on these stress tests?
Well, we still do them,
but
there are more modalities that we can take advantage of. In the realm of prevention, we have something called calcium score. Which has been used in the past, but there's more and more data showing how powerful it is as a predictor of heart disease, even in patients who do not have heart disease, but they have some risk factors like family history of diabetes. So in this case, this test can be very helpful and doesn't take long to really do. There are other modalities that we use. Echocardiography is one of them. One of the advantages is 3D echocardiography that can give the structure a better look as if a surgeon is looking at it. It helps us not only diagnose the problem better, plan it better, and perhaps even guide the procedure in the operating room.
So if there were to be a blockage somewhere within this 3D imaging, you would be able to pinpoint it before cutting the individual open.
Right. The 3D images helps more with valve issues or surgeries on big structures. For smaller arteries, we have technologies such as cardiac CT, like calcium score I mentioned, but it involves putting an IV with modest amount of contrast that can help rule out the disease. So if it's negative, then you don't need to go into the heart cath that is invasive.
Awesome.
There are some other new technologies. One more word about cardiac MRI, which is a technology that has really come alive in the last few years, became more practical. The nice thing about it is its unique ability to give information that no other modalities can give. So an example would be a scar in the heart. In terms of somebody who's had a heart attack or any heart failure or weak heart, it helps us diagnose what caused it and what can be done about it.
And so when it comes to these new technologies, does it also help when it comes to like recovery time?
I think anytime you do less invasive testing, recovery is better. When you plan the procedure better, the outcome is always better. So it's good all around.
There you go. So it's always good to see and hear from some of the doctors and some of the new technologies that helps people that you help every single day at Nebraska Heart.
Thank you so much.
Thank you for joining us. And we will be right back with a recipe from the test kitchen. You're watching Channel 8 Eyewitness News Midday.